So thank you, Praveen. I'm going to be talking about Lifitegrast ophthalmic solution. Can I have the presentation? Lifitegrast ophthalmic solution 5%, a review in dry eye disease. Uh, so dry eye disease, as we know, is defined by Dews as a multifactorial disease of tears and ocular surface, which results in the symptoms of discomfort, visual disturbance, and tear film instability. And chronic inflammation is an important part in its pathogenesis. Now, if you look at the ocular surface immune response, a healthy system can respond to any injury by mounting a response to eliminate the pathogens. But if there's a dry eye disease, then it is a spiral of immune response with loss of return to homeostasis. So Liftegrast is the drug which is being used or has been used to treat dry eye in other countries, and very soon it is going to be available in India. It has got high aqueous solubility, well tolerated, short half-life with high clearance rate and low systemic exposure, isotonic with human tears, unique mechanism of action, rapid absorption into the ocular surface, and rapid systemic elimination. Uh, it protects the corneal surface and is well tolerated, and it does alleviate all the symptoms of dry eye. Now, it has a mechanism of action, and that is basically there is intercellular adhesion molecule which is present in the epithelial, endothelial, and the immune function cells in the inflammation. An increased expression of ICAM1 and T cell infiltration is seen in conjunctiva and lacrimal gland of the patients with dry eye disease. And ICAM1 is a cognate ligand of this lymphocyte function associated gene, or LFA1, which is an integrin expressed on the T cells. So once this formation of the synapse between the LFA and ICAM occurs, this causes T cell proliferation, cytokine release, and recruitment of more T cells. And LFA1 ICAM1 interaction has a major role to play in ocular surface inflammation and ocular immune response. So Liftegrast is basically a lymphocyte function antigen 1 antagonist, and it suppresses the inflammation by mimicking ICAM1, and it blocks the interaction between LFA1 and ICAM1. And so it disrupts the various key steps in the T cell mediated inflammation. So once that happens, the T cell activation is inhibited, cytokines are inhibited, it inhibits the formation of immunological synapse, and there's decrease in the ocular inflammatory cycle. And like I said, it is already being used in other countries, but in India it will be available shortly. Now, this is just to show the mechanism which I have already talked about. And these are the summary of the Liftegrast trials. Phase 1, Phase 2, Phase 3 studies have already been done. And they are by the name of the OPUS trials. And if you look at the studies which are published in literature, then Liftegrast in its multicentric trial also has shown that it shows improvement in the signs and symptoms of the dry eye. It reduces the corneal fluorescein and conjunctival lissamine staining, and also has been shown in a large number of cases to decrease the corneal epitheliopathy. And these were all placebo controlled studies and double mask multicentric trials, which have shown that even in terms of ocular surface disease index, and the patient symptoms also get better with it. Further, it is safe and it is well tolerated. So these are the OPUS trials which are done, and topical administration of Liftegrast is done 5% twice a day. And in these randomized phase 3 studies, there were 3 periods which were looked at: screening, treatment, that is days 0 to 84, and follow-up day 85 or 86. And the eligible patients were more than 18 years who had minimal signs and symptoms of dry eye disease. Now, this is the study, multicentric study, which was done in India, and this was a randomized double-blind parallel group activated controlled multicentric phase 3 study which compared the efficacy, safety, and tolerability of Liftegrast 5% versus CMC in patients with dry eye disease. The primary efficacy point was the eye dryness score, the ocular discomfort score, the OSDI change, the breakup time in the tear film. And the secondary endpoints were the Schirmer tear test, the corneal fluorescein staining, and the subject rated global improvement scale. So a total of 370 patients were recruited, and the study was conducted across 10 centers in India. And the group A, after unblinding, was actually the Liftegrast 5% eye drops, and group B was the CMC 0.5% eye drops. So, in terms of age, height, weight, and gender, both the groups were well matched with no difference between the two. And we compared the eye dryness score, then the trend of decrease in the eye dryness scores was seen in both the groups. There was gradual decrease from the baseline to study end, and this was significantly more with Lifitegrast than with the placebo. Likewise, there was a gradual decrease in the ocular discomfort score, which was again significant with Lifitegrast as compared to CMC. And so was for their tear film breakup time, where again it was significantly better. In terms of Schirmer tear test, the corneal fluorescein staining score, conjunctival redness score, all of them statistically were significantly better with Lifitegrast than with CMC. And this was the percentage of change in the study parameters in both the groups. The percentage of changes were higher with the Lifitegrast as compared to the CMC again. If you look at the adverse events, they were present with both the groups again, and the proportion of subjects in Lifitegrast group had as adverse events was 3%, itching, irritation, and burning, and the one in CMC was 5%, where foreign body sensation and headache were also present additionally. However, all of these were mild to moderate and they resolved without any sequelae. So, this is essentially the summary of the study, which I have already enumerated the results about. And even in the OPUS trials and other studies, it was shown that there are no serious ocular events. However, dysgeusia or altered taste sensation has been reported in 13% of the patients with the OPUS trials. So this was about the Lifitegrast, and I'm sure the company is going to market it very soon, and it is going to be available. So thank you very much for your kind attention.